Santos from Quirón Salud Barcelona and Instituto Ruiz Castilla. Today's video will be centered on the Elipse and gastric balloon that you can swallow. The intragastric balloons have been in the market for quite some time, and the mechanism by which they work is that they fill partially the intragastric space, reducing the amount of food that we can place there. This causes satiation to come earlier than it would normally, helping the patient reduce the amount of food intake at every time at every meal. It also has another approach that as the balloon fills the stomach takes longer to empty. This means that in between meals, the likelihood that you will feel hunger pangs will be reduced. Thus, it helps the patient both reduce the amount of food they take at each meal and reduce the necessity to take food in between meals. That said, what an intragastric balloon does, it helps the patient do what we should eventually start doing on our own, that is, reducing the amount of calories we take every day. All intragastric balloons currently available range from 3 months to a year. They can be adjusted or put through endoscopy. Regardless of which we're using, most of the weight loss that is observed occurs in the first 3 months. After that, a sort of plateau is seen in most patient populations studied. So the different balloons available offer very comparable amounts of weight loss when we see it along a whole year period of follow-up for the patient. What is different about the Elipse method is that this is an intragastric balloon that requires no anesthetic procedures for placement, that requires no endoscopy, and that is simply swallowed by the patient in capsule form and filled by the specialist under surveillance of radiology imaging. This is the Elipse balloon in its field state. It holds 550 cc's of a special solution that will come with the package that we use to place the balloon. What the patient actually swallows is a capsule, which is of a reasonably small size for it to be easily swallowed under preparatory medication that will reduce the gag reflex to a minimum, allowing the physician placing the balloon to help the patient along while they swallow it. The balloon comes with a catheter that will allow us first to visualize how long and how further it is down the GI tract until it reaches the point that we desired. And it's also radiopaque so that we can verify it by an X-ray when it's reached the point where we should start filling and when it's filled and located in the position that we wish it to be located. The mechanism by which the balloon will be eliminated requires no anesthetic procedure also. The balloon has a valve that is exposed to the internal fluid inside of it that will, in a 4-month period, dissolve, and the balloon will completely empty inside the patient's stomach. The liquid will be absorbed as water would in your stomach, and the balloon will be eliminated. What is eliminated of the balloon is this. This is an emptied out balloon. As you can see, it's very small, and usually the GI tract crumbles it to a point where most patients will never notice that they have passed the balloon in their stool. As far as weight loss is concerned with the Elipse balloon, whether the patient is treated with a single balloon or is treated with serial balloons, the amount of weight loss will be different. We can expect about a 10 to sometimes 12% weight loss in average, as we've seen in recent studies, when we use a single balloon. And we can bring that up to almost 15 to 18% when we use 2 sequential balloons. Not every patient can be treated with this method. You have to go first to a consultation where we will tell you if you're eligible for this treatment. The utmost important part of any medical treatment is that it is well advised by a knowledgeable physician and that the patient fits the treatment as well as the treatment fits the patient. Thank you.